patients needlessly suffer in a lot of cases where they could have had something done that's a less invasive option and preserves their thyroid function. So that's why I'm so passionate about this, because I
Yeah.
don't want people to suffer needlessly. We have 12,400 patients in our community on
Wow.
Facebook, but that
Wow.
doesn't include all of the people who reach out to me via other methods that don't participate in Facebook groups. So I've had patients from all over the world reach out to me from countries that I've no idea where they are. So this impacts so many people, and I'm just grateful to be able to give information and resources to people and help them the way that I was helped. So that's why I
Yeah.
do it.
Welcome to the Everyday Epigenetics Raw, Real, Relatable podcast. I'm your host, Susan Robbins, epigenetic human performance coach. This is where we discuss all things lifestyle, environment, food, exercise, work, mind, and social interaction as they pertain to epigenetic expression in a way that's relatable to everyone. So if you're ready to start viewing you as an individual, take control of your life and health, and get results, buckle up, here we go. Welcome to the Everyday Epigenetics Raw, Real, Relatable podcast. I'm your host, Susan Robbins, and this is the place where we talk about everything lifestyle and environment and how it relates to our genetic expression. So today, I am excited to have on a dear friend of mine who I met doing her podcast. And she is all about thyroid nodules. So if you're wondering what in the hell a thyroid nodule is, this is the place where you want to be today. And Jen's got a fabulous podcast. She is just your goddess of thyroid nodules, the queen of information. She really just wants to help everybody as much as she can who are dealing with thyroid nodules. And on the flip side, Jen has also been doing my program. We've done DNA with her and PH360, and she's done, surprise, a diplomat. And so we're going to talk in the second half of the show about her experience doing my epigenetic program and the benefit that it can have, what she's learned, what it's done for her, especially when dealing with thyroid issues. My guest's name is Jennifer Holkem. She's a passionate educator and advocate to save the thyroid whenever possible. After her own experience in 2019 with RFA treatment and a large benign thyroid mass, she founded Save Your Thyroid, which we'll refer to from this point on as SYT. A community aspiring to become a nonprofit organization for patients seeking FDA-approved, non-surgical thyroid preserving treatment options. Due to a severe lack of patient-oriented resources on this topic, Jennifer creates and shares educational content on her YouTube, Spotify, and social media channels. She devotes a full-time, and let me tell you, it is a full-time effort. I know this woman, her passion, this is it. She devotes her full-time effort to disseminating all these free resources to the SYT community and the public at large. I'm so excited. We had to put this off last time, and I'm so glad we finally got to do this again. So welcome, Miss Jen Holkem.
I'm so happy to be here, Susan. Thanks for having me on.
So let's start first. What is a thyroid nodule?
Thyroid nodules are not necessarily cancer, which is what almost everyone thinks when they first come to that diagnosis. They always come into our Save Your Thyroid Facebook community terrified that they have a life-ending disease. Let me just start off by saying thyroid nodules are just little growths on the thyroid gland, and 90% of them are benign. They usually aren't even detectable by sight or by touch. Oftentimes, they're just found on these incidental imaging studies that are done. Say you have a car accident and you have to get some imaging done. You've got an X-ray or a CT scan.
Mhm.
And it's not uncommon for patients to come to our community and say, "Oh, I went in for some other imaging, and they said everything was great except for you have this thyroid nodule. You might wanna follow up on that." And it's very unfortunate that doctors don't usually tell patients that statistic that I just mentioned. And so it's very scary for a lot of patients. And so that's the first thing I want to make abundantly clear is that
Mhm.
90% of these nodules are very much benign and they impact up to 80% of people. And
Wow.
yeah, the population is walking around most of the population is walking around with these thyroid nodules, and most of them don't know it, and most of them aren't bothered by them, and that's okay. It's not necessary to take action when you have a thyroid nodule unless it's bothering you or unless it is cancer. And that's a different ballgame that's a little bit outside of my wheelhouse because I generally deal with people with benign nodules, but there are some treatment options out there for some patients with the cancerous nodules as well. But they're benign most of the time. That's the driving point I wanna make for these viewers today.
Yeah, I mean, that's 80% of people. That it's so interesting because I saw a chiropractor, shoot, I think it was like 2018 or 2019, and he did some special scan, and he said, "You have a nodule on your thyroid. You might wanna
Yeah.
get that checked." I still haven't had it checked, but it was he said, like, he X-rayed up at the neck part because I had had a car accident way back and my neck, I said, "I know my neck doesn't curve like it's supposed to." So, again, just it was just, like, exactly how it went down as you said. Now, you said you don't always have symptoms. What are some symptoms that are common with a thyroid nodule?
For me, in my the beginning of my journey, I had 0 symptoms, and I was very unaware that I had a nodule until it got quite large. So,
Okay.
just to back up and give a little bit of my origin story, my diagnosis story, I was at a routine OBGYN follow-up, and my doctor was talking to me, and he stopped mid-sentence and looked at me and and tilted his head and said, "I think you have a lump in your throat." And I was like, "What? Oh, you're right." And that started the whole diagnostic process. But up to that point, I had no idea it was there. I didn't even notice it in the mirror. At that point, I did started to notice it, but it was very,
Yeah.
very subtle. But I had no symptoms. I didn't have any idea. And then over time, the following year, I was pregnant with my second child, and pregnancy is a common cause of growth of thyroid nodules. Over time,
Oh, wow.
the thyroid no I actually had multiple thyroid nodules, and over time, they grew larger and they fused together into one really big thyroid nodule. And so my diagnosis was in 2014, but they didn't really start to cause symptoms as far as compression on my throat, causing me to have difficulty swallowing and breathing until 4 years later. And at that point, I thought, okay, maybe my thyroid function is off. I didn't feel so great. I was really exhausted. And I went to the doctor, and my thyroid labs were completely normal. So it's not even necessarily that patients will have their thyroid function affected by thyroid nodules. Now, there are some thyroid nodules that secrete excess hormone. Those are called toxic thyroid nodules. And in
Okay.
that case, it's different from autoimmune thyroid disease, such as Graves' disease, that causes the entire gland to oversecrete hormones. This is literally just one little spot, one little nodule in the thyroid gland that's producing this excess hormone. That wasn't the type of nodule I had. I had just a regular old cold thyroid nodule. But some patients do present with early symptoms of shakiness in their hands. They feel anxious, they feel hot, they feel rapid heart rate. Those are symptoms of toxic thyroid nodules. But the
Okay.
vast majority of patients, they start to have a cough. They start to have a feeling of something stuck in their throat. They start to notice that when they lie down at night, they can't breathe unless they lay on their side. These were all symptoms that I was having in 2019. When it finally came to a point where I had to do something about this thing because it had gotten quite large. And so patients that are experiencing symptoms like that, I would definitely encourage you, even if you've not had an incidental finding, but maybe you suspect you have something, you're feeling your neck or you're having these symptoms, that's a point where you wanna go and have it investigated because you wanna see, is this thing in my neck the cause of is do I have something in my neck causing these problems, or is it something else like reflux or something like that?
Where in the neck would you tell people to feel around?
So, a typical, a kind of do it yourself exam is to lean your head back. First, start with a glass of water. Take a
Mhm.
sip of water and then hold it in your mouth and lean your head back and swallow, and you can watch your neck in the mirror, and if you see something moving over on one side, that's usually an indication you have a thyroid nodule.
I gotta
If
try
you
this
see
now.
nothing or if you see the whole thyroid gland evenly, then there's usually nothing there. Now, just to give you a little bit of context, I do have thyroid nodules on both sides of my thyroid gland, and you can't see them. So,
Uh-uh.
that's what I was saying earlier about how a lot of the time, and the doctor, I just went to the doctor last week. Doctor was feeling my neck. "I feel nothing." So, a lot of these nodules are not detectable by palpation or by symptoms
Yeah.
until they get quite large.
So if you're saying if you're having symptoms, something doesn't feel right, what are the investigative tools that are used medically to find the nodule?
So the gold standard of imaging for thyroid is the ultrasound, which is wonderful because it causes no
Yeah,
complications. There's
no
no exposure
radiation.
to radiation. It's painless and it's an inexpensive medical diagnostic
Mhm.
tool. And you can go into your local physician's office, and a lot of times they can even have them done in the office, and if not, they can send you to an imaging center. It's not required that you see a surgeon or an endocrinologist at that point for diagnostic purposes. That will probably come later in the process, but just for that
Mhm.
initial finding, your local doctor can handle that usually.
And if you do have a nodule or nodules present, at that point, do you suggest the endocrinologist? Do you suggest a surgeon? Like, what kind of doctor? Because we know the endocrinologists aren't great with thyroid, like, with thyroid meds. Everybody gets T4. Like,
Mhm.
so how, but this would be different
So
than
what
just a hypo or a hyper.
because it is not, yeah, it's not usually a hormonal issue. And
Okay.
so this is where my opinion might differ from a lot of doctors, and that's okay. I have a lot of physician colleagues who I highly respect, but I don't necessarily think you have to go to an endocrinologist if you have a thyroid nodule, because in the world of thyroid nodules, we have multiple physician specialties who address these with the non-surgical treatment options that we talk about in Save Your Thyroid. So the endocrinology world, if they do ultrasound, which is not always the case, they can be helpful. Also ENTs, which ear, nose, and throat,
Oh, yep.
they deal with thyroid nodules, and sometimes ENTs and endocrinologists can specialize in just the thyroid. So that's something you might wanna think about if you're dealing with
Okay.
this, is someone who specializes in the thyroid, because a lot of endocrinologists, they do a lot of diabetes cases, and it can be hard to
Mhm.
get in with them, especially if
Mhm.
you're on a time crunch. So we've got
Mhm.
endocrinology,
Makes
we've got
sense.
ear, nose, and throat. And then
Okay.
so this one is not someone that a lot of patients think about, and it's not always available locally, but interventional radiology. These are doctors, they're typically in larger hospital systems who do endovascular procedures like in the heart, the liver, the kidneys, and they are well versed in non-surgical minimally invasive techniques. And so they're
Okay.
different from just your typical radiologist who reads ultrasounds or x-rays, because they do interventions. And the reason I bring them up is that they're already like I said, well-versed in the non-surgical realm of procedures. But the procedures that and I'm gonna start by saying these are FDA cleared. These are not something you go get in a back alley in a rough area of town. Like, these are legitimate
Find
medical.
someone's kidney.
Right. These are genuinely legitimate medical procedures that have just become FDA cleared in the United States in 2018. So, this isn't the sort of thing that you might necessarily be recommended at your local endocrinologist's office. For me personally, I was having to step outside of the box of my medical care team to pursue this procedure. The procedure
This
that
is
I had. Mhm.
the RFA? This is the
Yes.
RFA? Is that
Yes.
radio frequency ablation?
Yes.
Okay. I just wanna make sure everybody's yeah, is clear.
Yes, and I'm glad you stopped me because I don't wanna get ahead of myself, but
Yeah.
there are actually to date 7 procedures that are non-surgical to treat thyroid different types of thyroid nodules. And this is exclusively what we focus on in the Save Your Thyroid community and on my podcast. These are the procedures we talk about. So you've got radio frequency ablation, RFA. You've got ethanol ablation, PEI. That one is for cysts, only for cysts, really.
Okay.
Then you've
Okay.
got microwave ablation, which is similar to RFA. You've got laser ablation, which is also similar. They just all have slight differences. And then there's one called nanosecond pulse field ablation. That one is new and it does not use heat, it uses electrical current. The rest of those, let's see, RFA, microwave, laser, those all use heat. And then, of course,
Okay.
ethanol uses ethanol injected into the
Yep.
cyst. And then there's one called thyroid arterial embolization, and that one uses it's like an embolizing agent that is injected into an artery, and then it causes it's for these gigantic masses. It causes the nodule to basically lose its blood supply and die. And then the last one, it's not widely available in the United States, is cryoablation, which uses extreme cold. So
Cold.
all of these are non-surgical. There's no scar, there's no incision, and there's a very, very low likelihood of you becoming hypothyroid after the procedure because they preserve the thyroid gland. And that's the whole
The whole
point of what I
point.
do is to preserve the thyroid gland. If you don't mind, can I just go back and tell a little bit of my diagnosis story?
Do it. Keep going.
'Cause
You're
it's
yep,
really
this
it's
is great.
really relevant to why I do this. I didn't just wake up one day and decide that this was important.
Yeah. Yeah.
So I was diagnosed, as I said earlier, in 2014 with thyroid nodules, and at that time, I didn't really wanna do anything about them because I had no symptoms. I was I was I was vis I was seen by an ENT locally, and he said, "You don't have to do anything. I can take it out, or you can take medicine, or we can just leave it alone. The choice is up to you." And I said, "Why would I do any of those things, those interventions, if it's not causing me any problems at this point in time?"
Mhm.
So I left it alone. But by the time it had 4 years had passed, it had gotten a lot bigger, and I was really uncomfortable with it. Not only that, but it was unsightly in the mirror, and I was really self-conscious of it. Every time I took a selfie with my kids, I would delete
Noticed it.
most of them because I was just so embarrassed of it.
Yeah.
And I went to another surgeon and he said the same thing. He said, "We don't have to take this out." And I was like, "Was there anything else I can do? Because I really don't like it." He was like, "No, not really."
Mhm.
Something happened after that that kind of forced me to take action. And it was completely unrelated to my thyroid. But I had a urinary tract infection and I took some antibiotics and I had an
Mhm.
allergic reaction to those antibiotics. And
Did
within
your throat swell?
within just a couple of days, my thyroid gland had gotten massive. My thyroid nodule had doubled in size, and I was choking on everything I swallowed. I would even just be talking and just choke. And it was the
Wow.
most terrifying experience. because I thought, what's gonna happen? Am I gonna choke to death? Am I gonna be able to breathe? Is my throat gonna suddenly close up on me? And at that point, I had to do something because I could not live like that. I could
Yeah.
not lie down to sleep. I was exhausted. And that state of panic does something to you when you're under that for a prolonged period of time, it takes
Absolutely.
you so badly. And I would even get dizzy just turning my head to the side and feel like I was going to pass out because there was so much pressure on
Wow.
the neck. So the volume for those watching who are familiar with thyroid nodule volume, the volume of my nodule was between 65 and 75 milliliters. Now, to make that make sense to the average layperson, the ultrasound screen was small enough that they couldn't really accurately measure it because it was so big, it was going off the sides of the screen.
Oh my god.
So so I was very uncomfortable at that point, and I I knew I had to do something, and I simply did not want to have surgery. I had another backstory, which I won't go all the way into, but I had surgery on my knee when I was 18 years old that went horribly wrong and actually had to have a second surgery a week later, and I almost died from a staph infection from that surgery. And so to talk about having life-altering surgeries, that was definitely a life shift, a trajectory shift for me with my health and my life that I still feel the effects of today, and I'm 42.
Wow.
And so
Wow.
at this time, when I was in the office talking to the ENT about him taking out my thyroid, and he's talking about taking out the whole gland, even though I just had the nodule on my right side.
Why would they
I
say take out the whole gland? What's the reasoning of wanting to take the gland?
It's not uncommon, Susan. It's actually the thyroid is seen as a disposable gland in a lot of cases. That's shifting out of vogue, thank goodness, but because levothyroxine is so ubiquitous today, so many doctors just say, "It's no big deal. We'll just put you on this pill after your surgery and you'll be fine." And I knew from my experience with my knee surgery that I don't typically recover or do well after surgery and don't do well on medications. I've just gone through this allergic reaction. I've had many in the past. And I was so uncomfortable with the idea of surgery that it was making me ill just to think about it. And
Mhm. The
I
anxiety, yeah,
I
creating that
was
stress.
very direct with this doctor. I said, "If this same situation happens to me where I have an a staph infection after this surgery, like I did at 18, what are you gonna do about it? Because I can't take Cipro, which is the drug they gave me when I had the staph infection. I can't take that because that's the drug that just made this thing explode." I said, "So what are you gonna do? Do you have a plan?" And he was basically like, "We'll just let the infectious disease doctor handle that."
Oh my god,
And
Jen.
I that for me, that was it. I was like, "Nope, I'm not doing it. I'm not doing it." And I walked out of the office, and then for confirmation, there was another thing that happened in the lobby. I was on my way to the restroom on my way out, and there was a woman in the lobby, and she was talking to her friend who was with her, and her voice was just absolutely atrocious. It was gravelly, it was hoarse,
Mhm.
and she said something to her friend about her thyroid surgery, and she was there for vocal therapy, and I said, "I'm so sorry, pardon me for
Oh my
interrupting,
god.
but did I just hear you say you had your thyroid removed?" And she said, "Yes, and I have to take vocal therapy because my voice was harmed by the surgery." So, I had 2 confirmations at that point that I was
Yeah,
like, "I can't do
not
this. I
supposed to.
just can't do this." So, I went home and I was praying. I was just like, "God, I don't know what to do. I can't live like this, but I have to do something." And I discovered radio frequency ablation online. And at that time, it was only available in 2 states, and now it's a little bit more widely available. But I reached out to some the doctors that were offering it. I sent them my records. I said, "Here's my story. What do you think?" And they both agreed that I was a candidate. And so at that point, I was like, "This is what I'm gonna do." And that's how my whole YouTube channel started was I decided, "You know what? I'm gonna tell people what I'm gonna do. They may think I'm crazy, but I have to tell people about this because it was so hard for me to find information about it." And like you were reading in my bio about the lack of patient-oriented resources,
Yeah.
there was literally one testimonial that I found online from a patient.
Wow.
I could not find any Facebook groups. I could not find any I found medical literature, which is oriented towards physicians, and I read a lot of it, and I did a lot of Google searching on words that I didn't understand. I asked in all the forums I was in, "What do you know about this?" And there was just nothing out there. And so, on my trip to Virginia, which is where I ended up having my procedure done at the University of Virginia, I was really anxious because I was so unfamiliar with the patient experience, and I wanted to hear from someone else who had been through it already, and at that time, I had only published 1 video on my channel, but someone had shared it in one of the Facebook groups that I was a member of at that time, and I was like, "Oh my gosh, they shared my video," and someone commented under the video, "Oh yeah, I had that done." And I was like, "I have to talk to this lady." And so I sent her a message, and we spent the next 2 hours chatting about her experience. She went to the same doctor that I was going to see, so she was able to
In
tell me
Virginia?
in Virginia,
Oh,
yes.
the one in Virginia.
She was able to tell me all about her experience, give me details about things that I hadn't thought about. She told me the doctor was wonderful, had a wonderful bedside manner, all of the things that you worry about when you're going to see a new doctor, especially when you're traveling thousands of miles.
Yeah. Yeah. It's like, that's not a quick trip for you.
And so that was 9 hours by car for me.
Yeah.
I'm in North Alabama and Virginia,
Yeah.
in Charlottesville, Virginia. So to make a very long story a little shorter, I the life the procedure was life-changing for me in that it changed my thyroid nodule. Within a month, my symptoms were nearly gone.
Wow.
It's
And how
not
they
an
stayed.
immediate result. It does take time for the nodule to shrink. The way these procedures work is a probe is inserted through the skin into the thyroid nodule. The tip of the probe heats up, and under ultrasound guidance, they're able to selectively target just the thyroid nodule and destroy it. And
Mhm.
it's all done under local anesthetic. I had a neck full of lidocaine injections. I was completely comfortable, didn't have any pain. There was a moment or 2 here and there, but
Yep.
I didn't even know he had started the procedure for 30 minutes, and then he said, "How are you doing?" I said, "I'm waiting for you to
So you're awake through this.
You're
You're
awake."
totally awake through.
Yes,
Oh, okay.
your whole the whole point of that is so that they can talk to you and ask you questions and monitor
Okay.
for anything that you're sensing or feeling that's
Yeah.
uncomfortable. They wanna make sure that everything is there's a lot of critical structures in your neck. You've got your esophagus,
Sure.
trachea,
Sh-
lots of veins, arteries, and nerves. They want to stay away from those. So
Yeah.
similarly to when you're having brain surgery, they want
They
you
want to
awake
talk.
so they can
Yeah.
monitor all of that.
Yeah.
But
Yeah.
my symptoms were so drastically reduced within such a short period of time, and then they just continued to get better and better and better, and after I had such a wonderful experience with that, I thought, "I can't not tell people about this." This was life-changing for me. I've prevented myself from losing a vital part of my body that does so many important things for you can
Master hormone.
adequately replace thyroid with a pill, you just can't.
No.
And let me tell you what was also very motivating to me to avoid surgery was the patient stories that I heard about surgery in all of the forums I was in. I read so many horror stories. And it's not to say that thyroid surgery is wrong for every patient, but
Mhm.
it's not done well in a lot of cases, and neither is the hormone replacement afterwards. And so patients needlessly suffer in a lot of cases where they could have had something done that's a less invasive option and preserves their thyroid function. So that's why I'm so passionate about this because I
Yeah.
don't want people to suffer needlessly. There's no point in it.
Mm,
And
mm.
it affects so many people. Think about how many people are walking around feeling less than they should because they've had their thyroid removed, they're on inadequate thyroid hormone replacement, and all of the other things that come along with thyroid dysfunction that you can't even you start losing your hair. Yeah,
Your
that's
hair.
your skin is in
Yep.
this, but then your
Yep.
heart,
Yeah.
your metabolism. I with my knee surgeries, I couldn't afford to gain any weight. I have to keep my weight down for my joint to be able to not be under too much pressure. So it's just vitally important to me that people understand that there are options out there, but in order to circle back to where I digressed, in order to do this, you really have to be comfortable with kind of exiting the traditional model in the medical system. So, you go to your local
Yeah.
ENT and you ask about this procedure, and most of them are gonna look at you like, "Huh?" Which
Sadly, yeah,
which
we
is
laugh
what
about it, but
happened with
sadly.
me. I went to my ENT and he said, "Oh, you don't wanna do that. That's terrible. It'll destroy your thyroid and you'll end up having to have surgery anyway. It's no big deal. We'll just do the surgery." And
Oh, God.
that so that's why I created SYT is for patients to be able to find the doctors who are offering these procedures. We
Mhm.
actually on our website, which is saveyourthyroid.org, have a list of doctors both in the US and abroad who offer all of the different non-surgical techniques. And so for a patient to go down this path, they are going to have to advocate for themselves and they're going to have to initiate a lot of this on their own. They're not gonna get referrals most of the time.
As with anything anymore, that's why you and I vibed from the first time we talked
Mhm.
with what we do. Like, we both have our experiences. Like, no one should have to go through what we went through. If you can reach one person to
Absolutely.
save them from the frustration, because it is debilitating
Mhm.
when you just want answers and you're told that you're crazy and you have to do all. Now for you, it was a good thing you're a diplomat. You like to research. But you think about
Right.
somebody like me who I'm not all about research. I just want to know what to do. That's even harder. Um, so the beauty of it is you have your at least that health tech that is, I want to know more. And you want to plan.
Mhm.
And none of these doctors, these doctors are giving you plans that you're very uncomfortable with. None of them was a good answer for you. It's
Right.
here's what we do for the general public, but you had to look at you as you. What's best for me? From best for me is not losing my damn thyroid.
And
Uh,
not only you, but your family. So,
yeah.
I have 2 children and a husband, and at the time when I was going through all of this, my kids were young, and
Mhm.
I was thinking about what I went through with my knee surgery experience at 18 with no children and no husband, happening to me again, only with the responsibilities of being a wife and a mom, and I just could not
Yeah.
handle the idea and the concept of not being available for them,
Down.
being less
Yeah.
than for the rest of
Yeah.
my life as
Yeah.
a result of all of the consequences that come from the surgery, and that is not uncommon actually in our community. It's the vast majority of our patients are young women with children, and they come to our community and they're scared because of the same reason. They need to be there for their children, and we want to help them preserve their quality of life so that they can be there for their families and also just to protect their own health.
Yeah.
Think
Yeah.
about how many things would be better in this world if people just felt better.
When you don't feel good, and you and I talked about it yesterday, we both have gone through some pretty stressful things the last few months. And you don't feel yourself. Your quality of life significantly declines. And that it just creates it just creates such these awful feelings. It's like
It's a
it gets
domino
you more
effect.
frustrated. It is, because then you get more frustrated about not feeling yourself because of everything that's just built up, and yeah, I totally get it. So questions, a couple questions here.
Mhm.
What about cost with these procedures? Are they covered typically by insurance, or so because they're a little bit considered radical off the normal? Are they covered by insurance? Are they costly if they're not? Just so people have an idea about that as well.
Unfortunately, it's not cut and dry, and it's not uniform across the board. In the United States, on January 1st of 2025, we did have a code for billing of RFA be become active in the United States. And so what that means is that insurance companies and Medicare can cover the procedure. However, that doesn't mean that they always do. That kind of takes time for the insurance companies to change their policies as far as, because up till now, without the code, they would sometimes cover, and they would sometimes say, "Oh, we're not gonna cover this experimental procedure," even though it's FDA cleared, which does not
Yeah, yeah,
make any
that
sense.
don't make sense.
And then so that's with RFA. We're waiting to see how it all shakes out. There are still some doctors who do the procedure outside of insurance because they operate outside of insurance. And so there's been quite a up to now, there's been quite a number of patients who've paid for this procedure with cash out of pocket, and there are a number of financing options out there for patients, payment plans and things like that. But the vast majority of patients find it worthwhile to pay for it out of pocket, because even if you did have an insurance covered thyroidectomy, your out of pocket would probably not be that different, to be honest.
Mhm,
Now, it's going to vary based on your insurance company, your policy, and where you live, because every state's different. But that's
mhm.
the situation with RFA. With
Okay.
the other procedures, they're all it's gonna be dependent upon how long they've been in existence. The ones that have been around the longest typically are covered by insurance. The newer ones like NSPFA, the Nanopulse one, that one is not covered by insurance yet on a routine basis, but that doesn't mean that it won't be. It's just new. So with time, I'm sure all of them will be
It'll end up.
covered. And
Yeah,
with the more physicians who adopt them and the more widely available they are, I believe the insurance companies will eventually come around. It just takes time.
this takes time. Yeah, unfortunately. When you're suffering with one and having the symptoms of the not being able to breathe or whatnot, time is not your friend.
No, it is not. And for my procedures, so I had to have 2, just to be clear. I
Okay.
so my nodule was very large, and I could send you a picture for you if you wanna add it
Oh,
in
you're
post.
totally gonna have to. Yeah.
I had this really large, like, I would turn to the side and you could see it bulging out on the,
Wow.
and so not only was it large, but it was long. It went down below the collarbone area.
Like,
And something for the viewers to understand about ultrasound is that it doesn't see through bone. And this is an ultrasound guided procedure. So you can't treat what you can't see. And it's just not responsible. So my doctor treated the upper 80%. And then after it started to shrink, it pulled up that bottom part. And that's natural because of the action of our lungs. Anything
mhm.
that is pushed down because of growth will push back up if it shrinks. And so that's what happened with
Okay.
mine. I went back 9 months later and had my second RFA literally the last day before everything shut down from COVID. Was completely a miracle that it happened. So I did not know going into these 2 procedures whether they would be covered or not by my insurance. And I actually had to sign a waiver saying that if they weren't covered, I would pay the
You're gonna
whole
pay.
amount. And I just told my husband, I said, "I don't care if I have to dig ditches. I'm doing this. I don't care. I'm not having surgery." And
Yep.
that is the mentality that so many other patients have as well, is just, "I would rather pay for it and keep my thyroid." So,
Yeah.
it's so important.
That's it's such a crazy story.
Yeah,
Crazy what you went through, but what you went through allows you to help all these people today. So kudos
100%.
to you for turning that into something and seeing that. And again, I know the passion. I know you, and I know the passion you have for this. And I'm so proud of you because you've had some tough times recently, like
Yeah.
talked about really stressful stuff, and the passion's still there for
Yeah,
help.
I have to just say, to be honest, and I appreciate what you said, is very kind, but I feel like God turned it around because I was like, when I was in the midst of it, I was like, "God, this is just not like, how can you let this happen to me? You knew what was gonna happen when I took the antibiotic. Why'd you let me go down this path? This is not good." And the only thing that could have helped me see what he was doing was to go through it. And that
Yeah,
once I got on the other side of it, I was like, he was taking this awful situation, making it better, turning it around for good for me, and then now for thousands of patients. We have 12,400 patients in our community on
wow,
Facebook, but that
wow,
doesn't include all of the people who reach out to me via other methods that don't participate in Facebook groups. So, I've had patients from all over the world reach out to me from countries that I've no idea where they are. So, this impacts so many people, and I'm just grateful to be able to give information and resources to people and help them the way that I was helped. So that's why I
yeah.
do it.
Y- We sit here like you said, and I said the same thing to myself. Why is this happening for me? Or to me? Why is this happening to me? When I got the gadolinium poisoning from that MRI contrast back in
Mhm.
2018,
Yeah.
and I was ready to die. It was pain that I have never in my life experienced. Bone, skin, nerve. It was awful. And I remember calling my Episcopalian priest. He had long moved from I was in Montana at the time. He was now in Oklahoma, and I reached out to him on Facebook. "Father John, I'm giving you a shout out." And he and I just developed a great friendship back when I was cop. And I remember I remember messaging him from my little portable sauna and saying, "Why would God do this to me? Why would he
Mhm.
put me through this?" And he's not putting you through it. You're not
Right.
alone. You're gonna be fine. And he talked me through that.
Yeah.
And I've been guilty of it with other things happening since then, going, "Why? Why?" But there's always been something that's come out of it on the other end
Mhm.
where you say, "You did this for me." That it
Mhm.
sucked going through it at the time, but in this
Right.
respect, thank you. And the other people that I can share my story with
Mhm.
and help one person live that better life or have a better experience, it's worth it.
Totally.
And but when you're going through the time,
It's still hard.
it's so
Yeah.
hard to just sit and go, "Why me? Why me?" And then you think, "Why not me?" My soul agreed to go down this path for
Mhm.
whatever reason. There's a lesson in here. There's a gift. There always is, even in our darkest times. But we have to go through those dark times. I say, go to the light, but it's dark as hell until we get to that light. And so again, kudos to you getting through that. Not everybody gets through that. We're fortunate to get through very difficult times and come out of it scathed, but better in a lot of respects.
Yeah.
Oh, some people don't. I'm not. I'm not giving you false kudos. You know, it's from the heart of congratulations for moving through things that were. It's everybody's journey is different, and that for you was super traumatizing when you had the surgery from being a kid. That's PTSD.
Totally.
It's coming back in that fear. And then
Mm.
you're in this diplomat body that is, I can't handle discomfort and fear and not having the first thing that maybe I wrote it down because it made me chuckle. You're like, you say to the doctor, "Do you have a plan?"
Mhm.
What's your plan? I need plans, bro. Do you not know that I need a plan for everything in my life? And right now you're telling me you don't have a plan. If something goes crazy with my thyroid, I'm like, you don't have a plan? Fine. It just
Yep.
is so it's so you. And so that made me chuckle as far as that goes. But
Yeah.
so now you've been working with and we'll at the end here, we'll make sure that you give all your info and we'll have all your contact info and group info, podcast, all of it on the notes as well, the show notes as well. And we'll do that at the end. But I want to talk now. You had when we connected, you initially reached out to me about DNA specifically. And I said, let's talk. And tell a little bit about where you were when you reached out to me because you were pretty more much specific and I just need to know what I need to do. And I said, well, then
Yeah.
that's not DNA. But you should try all of it because I think it would benefit you and I think it could benefit your listeners. So just so you guys know, I've done 2 podcasts now on Jen's. The next one will be out in the next week or 2
I think
that we
next week.
recorded
Yep.
yesterday. The other one was out a couple months ago, and we're following her journey. We started with the PH 360, and this last one we did yesterday that'll be out is on specifically on her DNA.
Mhm.
So you can always tune in and listen over there as well. And I highly recommend going to her podcast. She's a fantastic host. So for my listeners, tell a bit about where you were in life, what was happening with you when you reached out and you were like, I just need to know what to do.
Mhm.
how how we went from there and what you've been experiencing.
Oh my goodness. So I am one of those people who does all the things. Y- I'm always researching, trying to figure out what's the best way to eat, what's the right supplement. As far back as when I was diagnosed in 2014 with this nodule, I was trying to figure out what can I do to make this thing go away. And so a year ago, March of 2024, I ended up at my doctor's office because I just felt so bad, and I was doing more and more things to try to fix myself than I have ever in my life. I said, "I'm exhausted, I can't think straight, my hair's falling out, I'm gaining weight in spite of eating right and exercising diligently." And she checked my labs, and my T3 was low. Everything else was normal, but my T3 was low. And so she wanted to put me on thyroid medicine, and I was just really uncomfortable with that. I thought, "No, if I do the right things, it should come back up, and I just need to do the right things." And I did a lot of reading, and I finally decided after a lot of thinking and praying and reading that I was gonna try the thyroid medicine, but I was only willing to take certain kind of medicine. I wanted to take the Armour version
Mhm.
that's desiccated pork
T4,
thyroid
T3.
that
Yep.
has T4 and T3 in it because I felt like I needed the T3. And so I took
Mhm.
that for several months, and initially, I felt better, but the longer I took it, the worse I felt. I got tired, my hair was falling out even faster, and things just finally that fall got to a point where I was like, "Something is wrong." I feel like I almost had an adverse reaction, it was so severe, probably in September or October. I started having intense panic, anxiety, horribly like, painfully dry skin, and just could barely function, and my perimenopause journey was also going on at the same time, and I was already trying to address that with other bioidentical hormone replacement, and I was just like, "Something's off, something's not right." And so I went in and had more labs done and found out my reverse T3 had gone up, 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 up the whole time I was taking Armour thyroid. And so I said to my doctor, "I think I need to be on T3 only." And thank God she agreed. It's not uncommon from what I hear for doctors to not be willing to prescribe T3.
No, mine wasn't.
And
And I'm a
so
T3 only. Yeah.
I was really
They don't
grateful.
like
And
it.
by the way, when I was taking Armour, I was taking the smallest dose that they make, 15 micrograms, I believe. It's like the size of a grain of rice.
Oh
And
yeah, it's tiny.
even that caused my reverse T3 to go up to, like, a 20. So, I switched to the T3 only, and it was like night and day. All of my symptoms got better, everything started getting better, and I was like, "This is really interesting. Why? Why am I only tolerating the T3? Why am I having this high reverse T3? Why is my T4 normal?" And I started diving into reasons behind that, and I don't believe that my problem is lifestyle induced because a lot of people have trouble converting T4 to T3, the inactive to the active thyroid hormone, have a sluggish liver or a sluggish gut. I don't have a lot of symptoms that really point to that. And I learned about these genetic SNPs, D101 and D102. And I thought, I wonder if I have these. And I listened to several podcasts and I read some books and I ultimately was introduced to you. And that was what I wanted you to do for me was to check those 2 SNPs. Little did I know that there was so much more that I would learn from working with you. But ultimately, I did learn that I don't have the D101 SNP, but I do have the D102.
Mhm.
And that is why I felt so mentally foggy, so tired, so flat emotionally, because those are all symptoms of the D102 SNP causes hypothyroidism of the brain.
Brain specific. Yeah,
So
just so people know, D101 is what coming through on your lab results. And that's the conversion of the inactive T4 to the active T3, predominantly in the liver and the kidneys. The D102 is not detectable through labs.
mhm,
And so the other interesting thing with your DNA, your D101, you have both your alleles that are normal,
mhm,
and you are likely increased conversion. And so when we talked about that yesterday, the main thing with DNA is probabilities and propensities. So that's totally not expressing for you. Now I'm the complete opposite. I have both variants in both of those. I am like, and I went back and looked at my DNA last night. I was just going through it. I go through it periodically. Anybody who's done DNA with me, if you got my healthy awakening, anytime, pop in there. Do this every couple of months because we're always updating. And when you see update it because you're going to see you may see different SNPs. I don't know if you'll be aware of them, but we're always adding new things into panels. Oh, get in there and take a look because new research like is causing us to do different things.
wow,
But I went and looked and it doesn't just say low, it's very low. And so
wow,
I had the same symptoms as you on the same medications as you at the same dose. And then my doctor's like, just take more, take more. And the worse I felt.
yeah,
And she's like, I'm not giving you T3. I'm not
mhm,
giving you T3 only. Found somebody that does. And now I'm on 42 micrograms twice a day of T3 only. So the interesting thing with mine's expressing, you're not. And we went through some things that, again, can cause lower conversion issues, liver issues, low selenium, stress, chronic
mhm,
stress. That's one affecting me right now. And, but is it that? Because then we thought, could the ablation of the thyroid, the nodule, could that have affected
possibly.
those
I
enzymes?
don't
Right? So we don't know.
yeah, we
But
don't
what we
know.
know is, yeah, the
But the
majority of
interesting
people
thing is,
see with the
though,
DNA, it does.
you can go back and look at my labs from before I had my ablation,
Yeah.
and I felt hypothyroid back then. Even when
Mhm.
I was my T3 was like a 3.8, which is really pretty good. I felt
There's your normal conversion.
I felt
Yeah.
hypothyroid back then, though. So,
The D102.
something was off, and I will say this too, because we'll probably talk about this when we get into the pH 360. I at the time when I talk about having that 3.8 back in 2018, we were under a lot of stress. We were actually selling our house, renovating our house, moving. I had little kids. My grandmother was I was being her primary caretaker,
Mhm.
and it was a lot on me, and so I'm sure that the environmental toxins from the renovation, the stress, and being sleep deprived from little children I'm sure it all was playing a massive role in how I was converting. But on top of that, you add in the D102 making me hypothyroid in my brain. That's just a recipe for absolute horribly crushing fatigue
Yep.
and so
Yep.
that's what brought me to you. And then you and I first started talking about there's so much more. You were telling me it sounds like you want something really precise
Yep.
and that because I was talking about how I do all the things. I was 9 months I was carnivore. I was like willing to do whatever it took to
Yep.
be this disciplined, healthy person that I wanted to be and just it just kept eluding me. So yeah, so you and I went through and did PH 360 and
Mhm.
I learned that I was exercising at the worst possible time of day. I would get up at
In the
4:45 in
morning.
the morning,
Oh,
get
no.
it in before my day starts because I got all the
We're
kids and
supposed
the
to do.
home stuff to deal with in the morning. So I would do that and then I would start my day and I would go through the rest of my day. But I was wearing myself out before the day even got started. My diet, the carnivore diet, not a good fit for me, which I thought that was probably the case when my labs kept showing my cholesterol going up, 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 up. But I thought, "Oh, that's just because they don't understand how to interpret cholesterol," and also because my thyroid was going downhill, and that makes your cholesterol go up.
Yes.
The pH 360 helped me make some important food swaps, change my exercise. I structure my day a little bit differently now. I I am trying my best to do my workouts in the late afternoon and just trying to think more about what's right for my body and not how do I do all the things because I'm such a task-oriented person. If you saw
Yes,
my
you
phone
are.
right now and all the tasks that I have on my calendar today,
Mhm.
that's just how I operate, and
Yep.
sometimes you have to stop and say, "You know what? My body needs a break. Today, for my health and my well-being, I need to rest. I need to get outside. I need to be with my loved ones." And
Mm.
if I do that, I will be better off than if I forced and pushed myself to get this thing done in the long run. So,
Do you feel like it's helped you understand why you are how you are? Like
yeah,
being the planner?
yes, totally.
Mhm. And you number I didn't write down what number you are.
I think
But
it's
you have a
3:30.
you have such a guardian secondary about you. And you're
Yeah.
also so about just my family. I have to take care of family.
Yeah.
That's so much of what drives you. And that was a really interesting thing to see come out. I remember when we met after you started working with the pH recommendations. We hadn't even have the didn't have the DNA back yet or anything. And just adding a lot more making veggies like the primary, making
Right.
sure you're getting veggies or some fruit in with your meals, that you didn't have to eat breakfast if you didn't want to. You guys are actually okay with intermittent fasting. You
Mhm.
tend to do well with it because it's a body more that stores changing your workout times. And you were just like, you looked different when I saw you a couple weeks later, like, oh my God. And this, I just feel better. Your energy
Mhm.
had already started to change that quickly. It was
Yes.
pretty phenomenal. And then you went through a pretty stressful time.
Yes.
And coming out of that, you at least you have the tools to get back on and you're starting to feel better again by embracing all of that. And I it's just really cool to see. What are your biggest takeaways, do you think, with working with DNA or DNA, the biggest DNA takeaways? Because
Mhm.
we learned you I'm looking at your DNA right now. Like you were doing the carnivore, seeing everything come up and you've had the issues with blood sugar in the past as well, right?
Totally, yeah.
You're like you were set up for all of it. you were set up for increased risk for insulin resistance with high saturated fat intake. You're increased risk for two high inflammation SNPs, high impact inflammation SNPs, the IL-6, the TNF, and also for likely increased cholesterol numbers with saturated fat intake. And so we're gonna keep watching those things. Those were just even just a couple of the takeaways that were in here, and even um, because methylation looked fine, but you also didn't process the estrogen metabolites. That was
That
another
was
big one.
that was a huge one for me because I kept noticing I was getting puffier and puffier the longer I took estrogen, and I was like, "But I need the estrogen, it's helping me in other ways. What do I do?" And so through that knowledge of the SNPs that I have that are converting my or not properly detoxing those estrogen metabolites, I learned, okay, I need to employ some strategies to help with that. And so I'm taking a couple of supplements, DIM and calcium D-glucarate to help
Calcium
with that.
D-glucarate.
And it made an immediate difference. The puffiness went away almost immediately. So that was a huge takeaway for me. The let's see. The exercise timing was huge. The right eating was huge. I think it's just vital that you understand yourself. And I kept trying to put myself into other boxes that maybe weren't the right box for me, and I didn't understand why it wasn't working. All I don't wanna be, like, anti-carnivore. For the people who try carnivore and it doesn't work, unfortunately, what the rallying cry is often is, "Carnivore harder." You're not doing it hard enough,
You're not doing it. Yep.
and
Yep.
I feel so badly for these people because they're trying so hard. They're being so disciplined, and all they want is to be healthier and better, and they're
Yep.
just
Just
not
feel
doing it.
better.
And understanding that what is important for you and what's vitally necessary for your health might not be the same as the next person. That was why I
Mhm.
pursued RFA, was the fact that in spite of being told thyroid surgery is no big deal and you can take this pill, it doesn't work for everyone.
Yep.
It's not the right choice for everyone. And so ultimately, you have to advocate for yourself, you have to do your own research, and you have to make an informed
Amen.
decision on how you respond and do what's right for you.
Absolutely.
It all
Love it.
goes back to that, and I'm really
Yeah.
grateful for the things that I've learned from you in the last several months because it's been crucially important for me. I was not in a good place when we met. I said to you yesterday, I was thinking really hard about just forgetting about all this work that I do and just hanging it up because the stress and the time spent doing it, and I was so drained, I didn't have any steam, I didn't have any mental energy, and I didn't have any creativity, and to publish content requires a lot of that, and to
Sure.
counsel patients.
Sure.
I'm
Yeah.
having patients reach out to me constantly asking me, "Can you help me? Can you help me understand my situation?" And I'm like, "I can't even understand my own situation." So, I'm so grateful that going through this experience with you has brought back it's relit my fire. So, thank you for
I'm grateful to
helping
just be
me.
a part of to just have a little part of it and to meet you because we're just so on the same wavelength with
Yeah.
where we're coming from. We just d- as soon as we started talking, it, just the same goal of just wanting to help people, just wanting to make that difference, and so I appreciate everything you do, and I'm going to learn more from you because I feel like I've still got. I'm listening to all you said. I'm writing stuff down, going. I really need to get an ultrasound because I never pursued it, and I'm going. I'm laying there in bed going. I go to drink something or eat
Feel
something, and I
it?
feel like it gets stuck. Yes, and it's
Okay.
making
Yeah.
sense. So you may be
Time
helping
for
me
an
on my
ultrasound.
journey. Yeah, I know. Okay. Anybody that wants to reach out to you because you can do the counseling now with them, your podcast, your Facebook page. Give us all the scoop on how we can reach you. And we will also have this in the show notes as well.
Totally. So the Facebook community is Save Your Thyroid Non-Surgical Nodule Procedures. And you can also find the links to join that on our public website, saveyourthyroid.org. And then my podcast is called Save Your Thyroid with Jennifer Holkem. And if you want to find my YouTube channel, which the podcast is on the YouTube channel, but It's Me, Jen Again. I know it's a little confusing to have the two different names, but all of my social media is also It's Me, Jen Again. And my Substack, if you want to follow me on Substack, It's Me, Jen Again. If you want to reach out for patient consults, if you really want someone to help you kind of navigate this whole non-surgical procedure landscape, I'm now offering patient consults. You can just send me an email at saveyourthyroid@gmail.com.
Awesome. Thank you so much. I love what we're doing on yours and then on mine. And it's just such a pleasure. I said to Jen this morning, I said, we had a good warm up yesterday. I think we talked for
Yeah.
2.5
Yeah.
hours. I was like, geez, it's lunchtime. And when I got on with you, I had breakfast. Like lunchtime. But, I just think you're just an amazing soul with what you do. And I just have so much love and respect for you and appreciate you. And thank you for coming on and sharing all this, because 80% of the people, and you don't know, this is important to get out there. And actually, I had somebody reach out to me over the weekend
Yeah.
asking about DNA, specifically around thyroid. And I said, hey, and she said she's been an avid listener to my podcast. I was like, wow, thanks. Did you just found me through Google search? And I said, hey, now that we're talking, since you're an avid listener, I'll take suggestions, anything. She goes, more on thyroid. So here you go. So thank you. Thank you. Thank you. And I will see you again soon, my friend. Thank you for
I
joining us.
appreciate you so much, Susan. This has been an absolute pleasure, the whole journey. So
Thank
thank
you.
you.
And it's only beginning. So everybody, share this, share this, share this. This is fabulous information. Share it with somebody you know that has thyroid nodules. Maybe you yourself have thyroid nodules. Put the info out there so that Jen can help, and get out there, make it an amazing day. Be your most authentic self. And thank you so much for joining us. Thank you for tuning into my podcast. If you enjoyed this week's episode, I'd love for you to share it with someone who'd find the information useful. Please leave a review anywhere you listen to podcasts, and it'll help the information get out to others. If you're interested in seeing if we're a great fit to work together, the link is in the show notes below, where you can sign up for a free consultation with me. So go make it a great day and let your authentic self shine.